Conceptions about mental illness has often led to inappropriate treatment for patients who access hospitals and prayer camps aimed at curing mentally ill people. Ghana has 12 practicing psychiatrists for a population of nearly 24 million and 3 psychiatric hospitals.
A psychiatric hospital, for instance, with the congestion, not having resources, not having medications, patients being aggressive, then you're a young man or a young woman, then you ask yourself, do I want to spend the rest of my life this way? But since we are going to revamp that place, going to make it a state-of-the-art facility, people will be very eager to come and work there. So people will want to come in. We are also going to institute risk allowance and other incentive packages, because elsewhere in Europe it exists. We know that if you work in mental health care, you stand some risk compared with your colleague working elsewhere. And for that kind of risk, you should be compensated. So elsewhere, they have the compensation. Here, you don't have the compensation. You want to institute that policy. Once you have it, people will feel encouraged that, oh, after all, if I come to work in the mental hospital, at least I'm secured. So all these are measures and issues that will ensure that people get attracted.
So with this new bill, you hope nurses would...
Notwithstanding the current state, Acting Chief Executive of Ghana's Mental Health Board, Dr. Barima Osei said the legislative instrument, when finalized and approved, will require private mental clinics, non-governmental organizations, traditional health centers, and faith-based organizations to register so the activities can be monitored to prevent maltreatment and abuse of mental health patients' rights.
We are going to extend mental health care into the community. So it's no longer going to be somebody sitting in Accra tele-guiding. It will be people on the ground. So the district assemblies, the municipal assemblies, the metropolitan assemblies, they are really going to be responsible. We are going to have the regional and district mental health coordinating committees, and there will be subcommittees of the regional and district district health teams, and these health teams are themselves subcommittees of the regional, metropolitan, municipal and district assemblies. And that means on the ground, people on the ground will have direct influence, control over mental health care. And so that's what I mean by they will then be able to take into their own hands their destiny with respect to mental health care.
Sharing his experience on mental health at the community level, Executive Director of Basic Needs, an NGO involved in mental health issues, said dealing with mental health required long-term strategies, building community resources, training community officers like psychologists and counselors, and intensifying basic education.
We are also hoping that district assemblies will extend funding for training of human resources, psychiatric nurses, psychiatrists, occupational therapists, clinical psychologists, as there have been efforts to do to promote teacher education, nursing. Fund your sons and daughters to go and train as mental health professionals to come and operate in the district, so that the whole issue about state funding for training of nurses, state funding for training, could also become localized at the assembly level. After all, after that they are bonded to do the work. Then you can begin to be supporting efforts of national government or central government.
The discussion also sought to engage stakeholders at the community level to whip up their interest in mental health issues.